Hi, I'm Dr. Rashad Ryman. I'm here in Beverly Hills. It's New Year's Day. People are out shopping. And I want to tell you, I'm a dentist, a general dentist. I do implants. When I first got out of dental school, not many people wanted to teach me implants, but times are changing. I'll give you an example. Check this out here. This is Smile Direct Club. This company used technology to bypass dentists altogether and do direct-to-consumer braces, straightening solution. And it's right in the heart of Beverly Hills. I'm here on Beverly Drive. I'm on Brighton and Beverly, right here. And I'm right next to Dr. Zeef Simon's office, and I'm walking right there right now. If you join the Implant Blueprint Mentorship program, you will get to experience the same teaching methodologies that Dr. Zeef Simon shared with me that got me to a point right now where I'm at, where I do implants with the same ease as I do crowns, fillings, the general GP stuff. So if you have a dream, if you have an opportunity in your practice to do implants, why not do it at the highest levels? And why not do it with the best technology that's available to us? I'm here right now in front of Dr. Zeef Simon's building. It's right up here. Part of the Implant Blueprint Mentorship program is a one-day preceptorship where you can come here to Beverly Hills and shadow Dr. Zeef Simon. See what he does. See how he sets up his office. See how he talks to his assistants. We're walking in right now, and I'm actually going up to his office. He knows I'm coming, so he's on the 3rd floor. Getting in the elevator, 3rd floor. So we live in an amazing time. It's cool, I like these mirrors. We live in an amazing time. Who would have thought 10 years ago that dentists would be bypassed altogether and a company would go directly to patients and straighten their teeth? Implant dentistry is changing as well. And now you, wherever you are in the world, you can start with a blueprint, a knowledge base that, this is Dr. Simon's office here. All right, we're going in. It's New Year's Day, so there isn't anyone here walking in his office. So this is where you would come if you came to join the preceptorship. Dr. Simon.
Yes, sir. How are you?
There's Dr. Simon.
Nice to see you. What a surprise.
I started us outside in front of the Smile Direct Club building, and my point was to show that times are changing and technology.
Times are changing.
Yeah, big time. And technology is here, and what was not possible in the past is now possible. And we're in the process right now of releasing the Implant Blueprint Mentorship program.
Correct.
And can you just tell us a little about the power of this program, who it's for, and when people join, what they can expect?
Absolutely. Absolutely. So the Implant Blueprint Mentorship program is a 1-year mentorship and guidance program for dentists anywhere in the world that want to excel in implant surgery, want to do the best for their patients, want to grow, are willing to learn from mistakes, are willing to be in a group of like-minded people that love surgery, love to succeed and are addicted to success like us. So that's in a nutshell. So any dentist that wants to be excellent in implant surgery, that's really sums it up.
And it's not only implants, drilling a hole into bone and putting a screw. It's comprehensive in the sense that you also teach soft tissue surgery, because what's the wisdom from including soft tissue surgery into an implant program?
Okay, so one of the misconceptions and some of the major problems dentists are having in implant surgery is that they look at soft tissue and bone as two separate entities, and they just think about bone and to place an implant. They think about soft tissue later or not at all, and really these two entities are so connected. So if you don't think about the health of the tissue, the quantity, the quality of the tissue, your implants will fail, not because the bone was not good, but because the soft tissue was poor and there was a lot of mucosa and other problems. So
excellent.
It's a must.
Excellent. And I'm so proud of myself
I'm proud of
for
you.
taking the time and doing my due diligence to learn from Dr. Ziv Simon
Sure.
how to do surgeries like free gingival graft surgeries, connective tissue graft surgeries. Can we review real quickly the 6 core modules which will be released over 6 months
Okay.
as part of the Implant Blueprint Mentorship Program?
Or IBM, in short.
IBM.
In short, IBM. So basically, the way we built this program is very organic. If you think about being successful in implant surgery, what are the 6 steps that you must have to be successful? So the first thing we thought about is starting from the extraction and the bone grafting and creating a great implant site. This is really module number 1. So you have great ridges, so you don't have to struggle with concavities and knife edge ridges and compromise on the position of the implant and the size of the implant.
And that's huge. For me, that mindset shift, that implant treatment starts at the same time that you're doing the extraction was huge, because it changed the whole way that I approach cases, and it made it so that I put my patients through less surgeries in the future and I have better success overall. So the first module is
extraction and bone grafting. It's all about the implant site preparation. So you have an ideal implant site, to have those huge ridges so you can place an implant comfortably and without stress. That's really the point. Module number 2 is dedicated to planning your surgery, planning your grafting, planning the implant procedure, having a good understanding of how do we plan it at the specialty level. And that includes also the digital surgery. So you basically do a virtual surgery before you go in there and do it live. So that creates a lot of peace of mind, at least for me as a specialist.
I love that. And the fact that I'm a GP does not mean that I want to do things at a mediocre level. If I'm doing a procedure, I want to do it at the same level, with the same mindset, with the same eye-mind training that a top-notch specialist like Dr. Ziv Simon does here. And I'm grateful for the opportunity that I have access to someone like you to actually pick your brain, learn from your mistakes, and not have to do mediocre or sub-mediocre treatment.
No. Every dentist, whether you're a general dentist or a specialist, can and should strive for the best. No matter where you're at, no matter if you're in a very competitive environment like we are here in Beverly Hills, or anywhere in the United States or the world, you can excel. You can be excellent at implant surgery, and this is why we created these modules.
So module 1 is extraction, bone grafting, building the implant site, starting at the time of the extraction. Module 2 is the digital surgery, doing the digital surgery, planning how deep, how wide, what size, any additional surgeries needed. What's module 3?
Module 3 is all dedicated to soft tissue grafting.
Excellent. CTGs, FGGs, building the soft tissue foundation around an implant. Module 4?
Module 4 has to do with the drilling protocols. That's all about knowing the tools and the instruments and how to use them, and the drilling sequence. A lot of dentists fail not because they don't have good hands or don't have the education. They just they don't know what they're doing in terms of the instruments. They don't know how to set up their equipment, and their surgical setup is not proper, and the surgery fails, not because of the lack of knowledge, just because of the lack of preparation. So it's all about the drilling protocols.
Devil's in the detail, and a big thing is I got the opportunity to watch Dr. Simon work. I did a preceptorship myself with him, and I saw how he sets up his trays, how he talks to his assistants, how he stocks his rooms. This is all very valuable information. The devil is in the detail. Module number 5 is?
So going along the same line, now we have a great implant site. We created the soft tissue. We know the drilling protocols. We placed our implant according to this protocol. Now comes the time to uncover the implant if it requires an uncovering, create ideal soft tissue, and how to give the post-op instructions so your patients heal well without pain, discomfort, complications, and all the other problems that take away from the success of the procedure.
Excellent. So stage 2 implant surgery and making implants and teeth look natural. And module 6 is?
Module 6 is all about the long-term maintenance of the implant. How do we maintain implants? What are the time intervals between cleanings? How do we clean an implant surface? What do we do when a patient develops peri-implantitis and other problems and complications? What happens in the long term? And that's module number 6.
And this knowledge is so valuable. It's been gathered over Dr. Simon's 20 plus years of experience. I've used this knowledge to excel in implant dentistry as a GP, and each blueprint is key to success, I feel. And you can shorten your learning curve, and you can not have to go through the same problems and issues that dentists who were learning 10 years ago had to go.
Including myself.
Yeah.
I've been through everything in the book, and I still have obviously complications and problems. This is just part of surgery. So I don't want you to go through these things that are avoidable. And there are a lot of avoidable things in terms of all of those 6 modules. There are mistakes that dentists are making, and I've made myself over the years. If you know about them ahead of time, you can certainly avoid them.
And one key thing as part of the IBM program is the access, direct access to you with cases. So whether you guys have cases coming through your door, you can photograph them, send the CT scan, and get coaching on each case. Do 10 cases like that with someone behind you, got your back, and you'll notice your skill level goes to a whole new level. So, we're going to close up this video right now. Happy New Year from me, and
for me as well. Happy New Year, and a happy and healthy and successful New Year. Let me show you around a little bit. This is where we'll have our preceptorship.
Sure, let's do that.
So 1 day is included in your registration. So we're here in my office. So this is the first place we're going to meet in the morning. We start at 7:30 in the morning. And then we'll do a little huddle, tell you what's happening this day in terms of what type of surgeries, what are we planning to do. The surgeries take place in room number 7. I'm going to show you. We have 7 operatories here. This is our front desk.
He's got a beautiful office here. You got like...
Let's turn the lights on. We are closing up for the new year. So the surgeries will take place here. I'll be performing the surgery right here in this chair. You'll be standing somewhere around here, watching behind my right shoulder. You can also stand behind the assistant and see the setup of how we do the surgery. We also are recording the procedure with a 4K camera here, so you'll be able to watch it on the screen if you'd like to. And then once we're done with the procedure, we're going to step out. We're not going to speak in front of the patient, but we're going to step out and review the procedure, and I'll tell you what I did, explain what were the steps, and we'll analyze it. So a lot of learning is happening here. And then depending on the day, we'll probably have a couple more procedures and go for lunch. Maybe meet Dr. Ryman here. His practice is not too far from here. And then start the afternoon. Afternoon we're going to go strong, maybe see a new patient, maybe do a post-op, maybe another procedure. It could be soft tissue grafting, could be an implant, could be an extraction. We may be doing a broadcast, so we may take you to the studio to watch our broadcast, and we'll spend a lot of time together. So that's our preceptorship. If you sign up today, you get 1 day with me. A lot of doctors have been asking us, what if I want to spend 2 days, 3 days, 4 days? There's an option for that. First, you need to sign up, and after that, we'll arrange for that.
Excellent.
What else do we need to talk about?
That's it. I think what's left is for you guys, if you're serious about taking your implant game to the next level. All this education has been gathered over years of experience, and it's tried and true. I'm a biggest example that this can work. I'm a GP, and I do implant surgery at the same level as Dr. Simon here. I don't do all the cases. I don't do all the cases. I refer those cases that I don't want to do to him because he taught me, he mentored me in a way where I should know my current limitations, and if I want to keep growing, then there's a way to do that. But it's just great to have someone that I trust, someone that's not going to judge me, someone that's going to guide me, that's going to keep me away from trouble in my corner. And you too can have that. So what's left now is click the link below or somewhere on this page. And if you're serious about taking your implant game to the next level, join the IBM. It's an amazing group of dentists, amazing, caring, excellence-focused dentists. And get direct access to this guy here. Let him be in your corner. And you'll see a monumental shift in the way you do surgery and implant dentistry in the next 6 months if you do the due diligence, put in the time, and are serious about this.
Exactly. So if you want to have great implant site, not struggle with thin ridges, if you want to have good drilling protocols with implants that don't spin, good soft tissue around our implants, follow those 6 modules, follow the implant blueprint mentorship program. Come visit me here in the office in Beverly Hills. I'm going to spend a full day with you or more. If you'd like, meet Rashad and myself. We'll be mentoring you. We are pretty nice people. love surgery, love having fun, love teaching. We are obsessed with education. We love educating. When we see a doctor that succeeds and gets great results, like I see your great results, I get a kick out of it. So join the IBM program. The Implant Blueprint Mentorship is closing up tonight at midnight. So have a happy new year. Join the IBM and we'll see you in the program. Take care.
Happy New Year.
Happy New Year.
Bye.